Okay, this one is on the elbow, wrist, and the hand. I'm going to break it up into elbow and then wrist and hand. I'll put those together. Chapter 6 and 7 in your book is where this information is. There's even a handout that kind of follows along. You can write some notes if you would like. So as we get into the anatomy, right, we've already talked about the humerus during the shoulder part. So we have the distal part of the humerus, and really we have these two bumps that I want to show you, is the medial and the lateral epicondyle. It's kind of like the malleolus, where there's two. You can put your thumb and your index finger on either side of your elbow and feel these bumps. On the medial side, usually pretty easy to feel that one. Same thing on the lateral side. So they're just those bumps. The reason why I bring up the epicondyles is because they are a site of attachment for not only ligaments, but muscles. And so you see here that I have the medial epicondyle having those muscle attachments for our wrist flexors, and then the lateral epicondyle is the wrist extensors. So you will need to know that. I would put a star or something right there. Make sure you know those. As we get into the forearm here, we have this radius and ulna. And you see how I put this. So a lot of times people just go, oh, ulna is the medial bone, radius is the lateral bone. If you're in the anatomical position, that works, right? So that's fine. I also want you to notice, if I just give you a picture of just the wrist and ask you, hey, what's this bone? As long as you can identify the pinky, then you know that's the ulna, and then the radius is going to be the other one, right? So the radius is always going to be on the lateral side at the elbow and always on the thumb side of the wrist. The reason, that's not the only reason. The other reason is that because of the way the elbow moves, this pronation supination, you can see this part right here, this supination is kind of your anatomical position. This is where we have radius being on the lateral side and on the thumb side, ulna being on the medial side and on the pinky side. But when we put our palms down, you can see that it crosses over. So this technically, this is the medial side, right? So ulna's here, but it's out here on this, what would be lateral, because that's the pinky. So anyway, make sure you have an idea of where those radius and ulna is so you can identify them. And this one is the important one here. The radius is the one that does the rotating during pronation and supination. So there you go. When we talk about joints, I'm not going to talk too extensively about the joints. I'm not going to actually make you give me the joint names and bones. It's pretty straightforward. Really, I just want to make sure that you have an idea of that there's all these bones that are coming together to join. We have flexion, extension, and pronation, supination are the big ones that I'm going to talk about. I do want you to know about the ligaments, though. So we have, this is a flexion extension joint. So we do have a radial and ulnar collateral ligament. The ulnar collateral ligament is on the medial side. The radial collateral ligament or lateral collateral ligament is on the lateral side. The reason why we call them by the bones is because if we said MCL, we always have to say MCL of the elbow or LCL of the elbow, because the knee is those get confused with the knee ligaments. And so it's easier just when you're in the elbow, we just call it the ulnar collateral ligament. And this is typically the radial collateral ligament. I'll give you another picture here so you can get the anterior view with these ligaments going around the outside of the joint. Same thing as we talked about before. We talked about that valgus and varus. So again, I told you, medial is always valgus, lateral is always varus. I have some pictures here. This is the normal, so normally we usually have a carrying angle in our arm of a little bit of valgus. If it gets out too much, you can see how that stretches the medial side of the valgus. And then varus, it's harder to get that, but you would, if this arm keeps going in, you're going to stretch this lateral side. When we talk about most of the common injuries, or it's more, the ulnar collateral ligament is way more commonly injured, primarily in throwing. And so you get a lot of valgus right here at this moment of throwing. In fact, I have a different picture right here. Again, as this arm starts to go forward and this back part of the wrist trails, this inside or medial side of the joint tends to open up, and that is a valgus force that hurts the medial collateral ligament or ulnar collateral ligament. You can also fall on an outstretched hand, and if that presents some valgus, he's probably more concerned about his wrist right there, but it can have some valgus issues. Varus is just not as common, and so this is the actual varus musculoskeletal stress test. You can see that he's pushing this part of the arm in, on this part of the arm, the joint, he's having a lateral force on it. So that would be, if that had more motion or pain, that would be the radial collateral ligament being the part. The final ligament, I just want you to be aware that there's a ligament that attaches the radius to the ulna, so that's the annular ligament to keep it in place as well, because that sometimes can get injured. All right, for muscles and motions of the elbow, it's pretty straightforward. You have your flexion, extension, pronation, supination. They're in the book and they're in the handout, so I'm not going to go too much more into that. There is some taping and things that you can do for the elbow. We're not going to do that in our class because they're really, really restrictive, and I don't know how functional they are, but this is what you're looking at right here is the hyperextension taping. So this is once we secure this here, and then once we secure it here, that's going to prevent that elbow from extending and do that. This is the collateral ligament taping, which is kind of the same concept. You put an anchor here, and then you just do some crisscrosses over the joint, and then you secure it. Again, trying to prevent this distal portion of the extremity going laterally. That would create a valgus force. And then there are some much more commercial. This is usually the reason why we don't tape, is because there's a lot of decent elbow bracing that can occur. So this is it's going to prevent that collateral ligament. It can also be tightened to prevent extension if we want. This is a fancy one. There's the normal neoprene sleeve ones that have these braces and ties that can go on there as well. So that's what I wanted to cover on the elbow anatomy function stuff. Then we get to the hand. As you can see, chapter 7 is where we go on the hands, and I'll go the same way. Yep, talk to the hand, Terminator. All right, so there's my diagram. As you start talking about, so again, this is, when you see the bones, if I'm asking you to identify these two bones, thumb side, radius, pinky side, ulna, make sure you got that. And then what we're dealing with here is our wrist itself. We're dealing with the distal portion of the radius. And then all these little teeny bones, which we call the carpels, all right? So these are the carpels. There's 8 carpels. Basically, I need you to know 2. The scaphoid and the lunate. These are the 2 right here, because that's going to be your wrist joint. It's scaphoid, lunate, and the radius is what we have. Just like the foot, we have a very similar kind of structure. In the foot, we had the tarsals, all those little kind of weird looking bones. Then we had metatarsals. So just like, so for the hand, it's carpels, metacarpals, and then we get into our phalanges, and you can see the joints are going to be the same as well. And it's easier to see all these, but you have 5 metacarpals, the 3 phalanges on each of these 4 fingers, and then 2 on the thumb. So it's pretty straightforward. When we talk joints, this is what you have to know. I'm going to ask you to star this. Make sure you know this. I will ask you, what is the bones that make up the wrist joint? And so that is the distal radius right there, scaphoid, lunate. That's how you can identify those. In the hand, we go right across the knuckles right there. That is your MCP, or metacarpal phalangeal joints. And then in the digits, in your phalanges, we have the same thing that we had in the toes. We have a proximal interphalangeal joint and a distal interphalangeal joint. On the thumb, it's just an interphalangeal joint, because there's only one of those joints there. And this gives you kind of a picture of what you're looking at. If you're looking at your hand, the palm of the hand is typically where you see those metacarpals, and then here's where your knuckles would be, and then your phalanges. This is the scaphoid, the lunate, the radius, that kind of stuff. So anyway, look at the book, look at the handout for the motions. You should know just some basic motions, what flexion and extension is, the deviation, and then pronation supination that occurs. When we talk about the muscles themselves, there's so many of these muscles that I'm not gonna pick one of them out to make you know them like I have in some of the other ones. So all I'm gonna do is call them a group. So our wrist flexors, I do want you to know that they originate from the medial epicondyle. And your wrist extensors, they do originate from the lateral epicondyle. That was earlier in the notes. It's now in the notes, so make sure you write that down. Make sure you know it. The deviation from side to side, depending on which one it is, they both have a flexor from one so this is if we're going to go on the medial side. So this is the we're going to go ulnar deviation. This is the flexor. This is the extensor. If they both contract, you get the motion that is ulnar deviation. And then finally, the only thing I really want you to know about the flexors of the fingers, your little phalanges, is that again, there's a lot of these. I just showed you the finger flexors, but they're on the palm side, so the anterior side of the hand, whereas the extensors are on the back or the posterior side. So that's what I wanted to get through in this video. I'm going to do the related conditions in class because I want to talk a little bit more about those and in face-to-face. So